Hello, this is a recorded patient history for the CLINEX exercise. The patient presents to the clinic with fatigue. Patient gets tired just walking through her house and can't sweep or do chores for more than 5 minutes without needing to sit down. She sleeps through the night and has been taking 2 naps most days. She was last here in November and her fatigue hasn't changed much since then, but it has improved compared to a year ago. Now she can walk a mile without taking a break, but she couldn't do so before. Her weight has mostly remained stable, but there has been minor fluctuations that require medication to help adjust. The patient has sleep apnea, but she uses CPAP to help. She sleeps on one pillow, and as a result of the CPAP, she does not wake up short of breath. Past medical and surgical history. The patient is an 52-year-old African-American female, and she has had asthma since childhood. She was first diagnosed with heart failure 3 years ago, and it was originally mistakenly misattributed to her asthma. She was short of breath and would feel a full feeling in her neck due to an irregular heartbeat. Her ejection fraction when first diagnosed was 20%, which has since improved to her current level of 40% after treatment and after moving from Colorado to here. She also has atrial fibrillation. To treat her irregular heartbeat, a pacemaker/ICD device was implemented in 2012, and that has eliminated her irregular heartbeat. She has given birth through C-section, and she has had chickenpox and measles as a child. Allergies. The patient is allergic to penicillin, nuts, and fish. Medications. The patient uses warfarin. The patient is currently taking warfarin, torsemide, lisinopril, pantoprazole sodium, potassium chloride, sotalol HCl, spironolactone, and topiral. Family history. The patient's father is alive but has congestive heart failure and high blood pressure. The patient's mother is also alive but has a history of diabetes and is currently borderline diabetic. The patient's grandfather and the grandfather's 2 sisters all died of heart failure that began in their 40s. The patient has 3 kids and all of them are alive and healthy with no signs of heart disease. Social history. The patient does not smoke cigarette, does not use tobacco, does not use alcohol, and has no history of using recreational drugs. The patient has a large and supportive family, and the patient was a prior active duty Air Force officer who was an engineer who worked in missile maintenance. After retiring from the Air Force, the patient works currently as a school teacher. Physical exam results. Blood pressure are on the low side, 99 systole over 68 diastole. The patient appears comfortable and relaxed, and there's no pitting edema of the ankles. The lungs are clear to auscultation, and the pacemaker/ICD are cool to the touch, and there's no fluid buildup around the device, meaning no signs of infection. The JVP is not measurable, and the jugular vein cannot be identified. The carotid arteries are clear to auscultation, and the heart sounds are all normal. There's no murmurs, no gallops, rubs, and the S1, S2 sounds are normal as well. The rate and rhythm are also normal. The ECG results. Sinus rhythm is around 80 beats per minute, the PR interval is around 128 millisecond, QRS interval is 124 millisecond, the QT and QTC is 468 milliseconds, and the PRT axis are 61, 84, and 2. Plans. It is important to evaluate for potential hypothyroidism to explain the remaining fatigue despite managing heart failure symptoms. Her thyroid is slightly enlarged, and there's slight proptosis, the bulging of the eyes, and that suggests elevated TSH. We should recheck the thyroid with an ultrasound and thyroid antibodies to determine if hypothyroidism is present. The amiodarone can cause hyperthyroidism, but the patient is not using the drug.